Here is something most men over 40 never consider. You can be training hard, sweating, pushing your limits, and still be working against your own biology. Not because high intensity training is bad, but because the way you're using it may no longer match your own body recoveries. Some research in high level endurance athletes has shown that chronic excessive cardiac stress without enough recovery can lead to structural changes in the heart over time. Now, to be clear, that's not what properly programmed HIIT looks like. But it does raise an important question. At what point does more intensity stop helping and start costing you? I'm Dr. Ngoundi, a medical doctor and a fitness enthusiast, and in the next few minutes, I will show you exactly how HIIT affects your body after 40 and how to use it in a way that it builds you instead of breaking you down. Here is the paradox. HIIT is one of the most time efficient and powerful training tools we have. Research constantly shows it can improve cardiovascular fitness, increase insulin sensitivity, stimulate mitochondrial function, and in some studies, it's even been linked to improvement of markers associated with cellular aging, such as telomerase activity. But here is what changes after 40. The stimulus still works, the recovery becomes the limiting factor, and hormonal output shifts, sleep quality can decline, and your ability to recover from repeated high intensity stress is simply not the same as it was when you were 25. So the question is no longer, is HIIT good or bad? The question here is your dose appropriate for your biology? Let's start with the first mechanism, which is cardiac stress versus recovery. During HIIT, your heart is pushed close to its upper limit. That's what drives adaptation. In a well recovered system, this leads to stronger cardiac output and improved efficiency. But when high intensity training is done too frequently without proper recovery, your body can enter a state of accumulated stress. Some studies in endurance athletes suggest that repeated excessive cardiac strength over a long period may contribute to structural changes, particularly in the right ventricle. Again, this is typically seen in extreme training volume, not normal HIIT. But the important takeaway is that the heart adapts to stress, but it also depends on recovery to remodel properly. Without that recovery, adaptation becomes less efficient. So the second mechanism is stress load and hormonal balance. Every HIIT session activates your stress response. That includes increasing cortisol, which is a normal and necessary hormone. In a balanced system, cortisol rises then returns to baseline. But problems begins when high intensity sessions are stacked too frequently, especially when combined with poor sleep, high stress life, and calorie restrictions. Over time, this can lead to a state of chronic stress load. And that matters because chronic stress can affect the hypothalamic pituitary gonadal axis, which plays a key role in testosterone production. At the same time, factors like aging and metabolic health can influence sex hormone binding globulin levels, which in turn affect how testosterone is actually available for your body to use. So it's not just about how hard you train, it's about whether your body has the capacity to recover from that stress. So the third mechanism is the sweet spot effect. And this is where things get interesting. Exercise follows a principle called hormesis. A small time stress is beneficial, but too much stress is counterproductive. HIIT is a perfect example. When used correctly, it can improve endurance, support metabolic health, and enhance performance. But beyond a certain point, more intensity doesn't equal more result. It just increases fatigue. Research constantly shows that moderate volumes of heat combined with proper recovery deliver most of the benefit. Not more, not longer, not harder, just smarter. So, what does this look in practice? Here is the simple evidence based framework for men over 40. First, you should space your sessions. Aim for 2 to 3 HIIT sessions per week. Allow at least one recovery day in between. 2. Keep your sessions efficient. Most benefits occur within 20 to 30 minutes. Longer doesn't mean better. 3. Use a control work to rest ratio. A 1/2 ratio works well for many people. As an example, you can do 30 seconds of high effort and 60 seconds of active recovery. 4. Pay attention to recovery signals such as sleep quality, resting heart rate, and energy levels. This matters just as much as workout itself. 5. Measure your hormones when possible. If you are concerned about hormonal health, speak to your doctor about it. You can ask for total testosterone, free testosterone, and SHBG, not because you want to chase numbers, but because you want to understand your baseline. Here is the bottom line: HIIT is not the problem. In fact, when used correctly, it's one of the most effective tools you have after 40. The real issue is mismatched: too much intensity, not enough recovery, and no adjustment for how your body has changed. Train in alignment with your biology, and HIIT becomes an advantage. Ignore it, and progress stalls over or even reverse. If this changed how you think about training, comment smarter below. If you want to know what could happen if you push your heart too much, click on this video to find out how it affects your body on a hormonal level. You'll be shocked with what you will learn there. Train smart, recover well, and I'll see you in the next video.